Good morning, everybody. I'm going to start with a bit of an icebreaker because this is not my day job. Everybody else is very professional and slick. I hope I can live up to that. My husband tried to put my mind at rest by telling me that about 58% of what you will take in is how animated I am doing a presentation, and that about 38% is going to be about what I look like. And the tiny percentage that's left is what I'm going to say. So when it comes to evaluation, I hope you like how animated I am, how much I'm moving. I hope you like what I've got on, and I hope there's something there for you to take away from what I'm going to say. And I do appreciate that not everybody's going to like what I say. It's not for everybody, but my feeling is that if just one thing resonates with you, then I've done a reasonable job in getting some messages across. And also, I'd like to stress that my remit today is actually to talk about myself and my family. It seems a bit self-indulgent, but I was asked to talk about real-life stories, and although I have experience of lots of people and their healthcare journeys, I am here specifically today to talk about our own journey. So when Liz asked me, would I take part in this, I thought, oh my gosh, she's got the wrong person. I don't know anything about technology, and in fact, my family would say I'm probably going to find out I've got something really important to do whenever I've got to do something that involves any kind of computer work. But I don't know much about bits and bytes, but what I do know is what it's like to be trying to travel a healthcare journey. And that can be a terrible task. And it would seem to me that we can send mission craft off to the far reaches of the universe, but you try getting your test results available to an appointment in the meantime. And it would seem to me that it shouldn't be rocket science, except of course the first one is. So this is me. I am patient voice today. And when I'd agreed to look at this, I thought, oh my gosh, again, I'm going to have to go away and find out what this is. I've never heard of interoperability. It's almost something I can't even say. So I had a look around some resources and discovered I actually couldn't really make head or tail of what it was. And I know Wikipedia is not the most erudite source of resource, but this was the medical definition of interoperability. And I thought, well, that works for me. I can understand what that means. And I think it's important to remember that if you're going to be trying to introduce this to people, you've got to be able to introduce it in a way that they can understand. And I think this is a reasonably simple definition. I hope you'd agree that it probably covers what it is you want to achieve. So what does it look like at the moment? Interoperability, we've seen the definition, that's what it means, but actually, what does it mean? For me, this is what I go through. I'm sitting in front of a piece of complex machinery that is the NHS and social care. I'm frantically trying to plug the right connections to get information put across, and it's difficult to make the right connections. It takes a lot of learning, and it takes a lot of learning to get it right. And often you're in a situation as a patient, as a family member, a carer, a parent, that you're doing it on your own. And this is a fantastic little cartoon that was drawn by a patient, and it shows what the navigational journey looks like. And across the top, you can see that there's quite a lot of input going on, but it looks reasonably straightforward. And then we get to the middle, and it's kind of beginning to lose it a bit, until we get to the bottom, where it's in complete meltdown. And this is what we're supposed to be able to navigate on our own. And this is what we want it to be like. We want it to be calm and serene and unruffled. And we want to be able to tranquilly get across our healthcare journey. But in fact, it looks like this. This is what it feels like. We're frantically paddling, trying to keep ourselves afloat as we get from A to B. And now to look at some actual examples. So, in the centre, we have a young person. That's my son. And this is the wheel of complex care that surrounds him, medical and social. He's had a condition since birth that's required quite a lot of care, and I'd like you to realise that this is not the wheel of care that surrounds him from birth. This is what he's needed in the last couple of years. And so everybody needs to cross that wheel in order to get information from each other. And there's an additional layer that's coming in now because he's 17, and that's the transition to adult services. Now, that again is a small nightmare on its own, because all of the people that are involved in his paediatric care have got to talk to the adult services, and that is a big gap in what we have to go through at the moment. Transitional services are known to be less than adequate. And so I really hope you like this, because it took me hours to put together. And this is a graphic of that wheel, in effect. So across the top, we have all the people that were on the wheel, and they've all got their own colour. And then in the columns down, we have who they want to talk to and who they need information from. So you can see that endocrinology need to talk to neuropsychology and neurology and specialist neurology and haematology and the dental unit and the GP and the community physio, and so it goes on. And then school need to talk to the neuropsychology and the endocrine and the neurology and the specialists and the haematology, and that goes on. And then in the far corner, you've got parent, that's me, Mrs. Mum, no particular qualifications to do the job, but I'm trying to get all the information together, get everybody talking to each other, and try and get all the information to where it's needed. And I'd have to ask, do you really consider that that's a parent's job on their own without some form of help? So I thought it might be fun for us to have a look at the pathway of a single letter on one of those communication journeys. So we're starting with a patient, and they go for their consultation, and then this is the course of action. So something gets dictated, and then it's prioritised, and then it's typed, and then it's sent, and then it's prioritised by the receiving secretary, and it's placed for attention. And then it's read by the recipient, who responds, and then they dictate that response and prioritise it, and it gets typed and sent. And then it gets back to the originating secretary, who reads it and prioritises it before putting it before the consultant or the clinician, who reads it and makes a decision based on the information it contains. And then the outcome's given at the next appointment, and then it gets to the patient. But the time span between the first point and the last point can be 8 weeks. 8 weeks for a letter to cross departments. And it might be 12 weeks plus before that patient is actually being seen. And in the meantime, that patient could have had appointments elsewhere and needed the information that was going to be gathered. Now, it can actually lead to reduced quality of life and withheld treatment, and that certainly happened in my family. So, why is data share needed? I'm sure many of you are familiar with great Fred Lee, and he said shifting work to other departments is a phony efficiency. And I think what he means, in fact I know what he means because I've read his book, he says that your jobs are about making other people's lives easier, not less work for you at the cost of more work to others. And I would say it's worth remembering that this is not just about your workspaces and your colleagues, this is about the people outside, this is about the people who your job serves. And again, more people are sharing information about themselves than ever before. There has been a massive culture shift with the advent of things like YouTube, social media, interactive platforms, and people are less inclined to think that their information is private. And data sharing is one of those ways where we can encourage people to use what is already becoming part of everyday culture. And I know that the NHS and social services have to balance the need between privacy and confidentiality, but then the people have a desire to share, And I think that what I've seen of data sharing is exactly what people would want to be involved in. Now, I'm going to ask you to indulge me a little here, because this is a personal story. And I'm wondering, and I'd like you to wonder, whether having the aspects of data sharing information would have prevented this. So I go off to Hospital X, and they tell me, we can't deal with your case, so we're going to send you to Hospital Y. And I go there, but that's in another region, so there's a bit of travel involved. And sadly, after a few months and a couple of visits, the consultant dies. And I really have to hope the two things weren't linked. But then Hospital Y tell me, well, we don't have a specialist anymore, so we're going to send you back to referring Hospital X. So I sit and I wait, and I wait, and I wait, and I'm waiting for information to come back, and I hear nothing. So I contact the original Hospital X, and they say, well, we thought you were being treated by Hospital Y. So I say, well, they thought I was still being seen by you. And I thought I was still being seen by you. Well, we've discharged you because we've sent you to Hospital Y. Well, they've discharged me back to you because they think I'm still under you. They think that they were just a second opinion specialist hospital and you're my local care. And anyway, they don't have a consultant now. Well, you're going to have to be re-referred to us because too much time has passed. You've fallen off the scale and you're going to have to wait to be seen again as a new referral. And I really wasn't happy with this. Who's going to be happy with this? So I went digging and I found out eventually that a letter from each place had been generated, but they were both ignored because each place deemed I wasn't their patient anymore. And the fact that they suggested that I needed to be referred by the person who died wasn't their problem, it was mine. And as was the delay in treatment, and I had a significant delay in treatment, which did impact on me. And eventually, I had to try and sort it out myself, and I went to Hospital Z. And so I'd like to have a look at some examples of what you might think is timely care, or you might not. And I'd like you to think about how data share, as with the other example, might have changed that. If I'd had data sharing for the other example, I could have had entered into that what was going to happen, and hopefully I wouldn't have fallen through that gap, because I'd have been able to take that myself to show people. So the endocrine and haematology departments occupy the same space, in the same building, yards from each other. But a letter from one to the other takes about 8 weeks. And in that time, treatment is withheld. And you have to think about, again, quality of life. The withholding of treatment can have significant impacts on people. And when you go to one department to another, why is it not the case that we can take along with us what was decided at that consultation so that you can actually inform people without the need for these long waits? The next one is a story where my son was an inpatient and he had some specialist procedures needed, but they were being done by non-specialist staff. And there was no understanding of the tests or the necessity for the really strict timing on those tests, because they were simply told, go and take some blood and put it in the orange top bottle. But they weren't told why or what the significance was. And being busy, they decided that they weren't going to prioritise that. So being a very assertive parent, I went along and said, look, this is really crucial that you do this. I had the information, they didn't want to hear it, and so I said, well, will you call the consultant, please, who'll confirm this? But it's late at night. Now, they offer a 24-hour on-call service, but the staff were too reticent to call, they didn't want to get into trouble, and they kind of pushed the phone across the desk and went, well, you can do it if you want, but we're not going to. So I did, and then that information was verified. However, by that time, too much time had passed between the tests, which had to be taken every 2 hours throughout the day and night. My son had been subjected to painful procedures, which were scrapped because the test results were useless. We couldn't proceed with his treatment because we didn't have the test results. And obviously there was the time and cost implications of taking up a hospital bed. Now, I really believe that when we'd seen the consultant who said you need to come in and have these tests done, if we'd had that on a record that I could have shown, then they would have understood what needed to be done. They are always so reluctant to take the word of an informed parent in case they don't get it right. So we definitely need systems in place whereby there is a recognised way of gaining that information without these time delays. So we've generated all these letters from all these people, and they have to end up somewhere, and they end up in folders over a foot thick. I've got one about this big, and my son's got two that big. Now, nobody wants to go looking in those for bits of information. And my consultant quite happily admits he's not going to look in them. So I have ended up having to develop a system whereby I carry my own handheld copies of letters to show him at my appointment times. Well, I do that because he's going to make decisions about my treatment, and if he doesn't know what other people have said and what other people are doing with me, how can he make an informed decision about my treatment? Because I'm not just the bit of me that he is a specialist in, I'm a whole person, and he needs to know what other people are doing. And how can I give informed consent for his treatment if he's not considering me as a whole person? Now, if I've got data share and a record whereby I can take that to him and he can see exactly what's going on, I do it under my own initiative to take these handheld copies, but how many patients are doing that? How many patients have got the assertiveness to actually say, well, you might not look at my letters, but here's some. Will you take 5 minutes to read them, please? And I absolutely insist on that, but I wouldn't mind having a system that didn't make me look like an awkward patient. So, person-centred care, we have to go to a London specialist unit, and 3 family members are seen because my condition is hereditary. But we're not sent together, we're given different appointments throughout the year for the same clinic. And so we have repeated storytelling going on and cross-referencing. And it may well be that when we get there, they'll say, how are you? And we say, well, we've done this, this and this back home under local care. And they go to the file and they haven't got the records yet. They haven't got the letters. And so we've travelled 400 miles round trip. And we don't actually get much further because they can't decide what to do until they know the information that's coming from the local source. Because I'm having to escort 2 family members, I've got the travel and cost implications of doing that. And then, of course, one of the reasons we have to go is our condition affects our mobility, and yet we're trailing backwards and forwards from Manchester to London, when in fact just having us all together and sharing all the information that came in on us on some kind of data share system would have saved an awful lot of time and trouble. And my son broke a tooth and needed a simple extraction of that tooth. And bearing in mind he has complex care needs. So the dental team decided that they needed information from all these different departments and hospitals. He has a bleeding disorder, so they were worried about doing that. He's an anaesthetic risk, so they were worried about that. He has an endocrine disorder that is dangerous if it's not monitored during surgery, so they needed to know about that. And we kept getting appointments, and they would say, oh, well, we haven't got all the information back yet, sorry about that, but next time you come, we'll be able to do it. And so my son's psyching himself up to have this done, as am I, because it is a bit of a risky thing to do. But it took 2 years to get all that information. And in the meantime, we had actually visited all of the departments they wanted to get the information from. So if that had been entered into some kind of record that we could have taken to dental, they would have known exactly what they needed to do. And eventually, when it was done, it took 5 minutes. Data share, I believe, will help with safety and checks and balances. I had to go into hospital. It was unrelated to my condition, but the standard drug treatment was not safe for me, and I had that specialist patient knowledge, but nobody was willing to listen to me. I had to refuse having the treatment simply because I knew it was risky and I didn't want to cause them problems they couldn't deal with. And I was asking them to phone the specialist nurse at the centre where they could corroborate what I was saying, but they wouldn't. All it took was a phone call, but they would not do it. And eventually, in despair, because I was getting quite poorly by then, I called the specialist nurse from my mobile whilst the doctor was on ward round standing at my bed, and I passed her the phone and said, "Will you please speak?" And then my information was corroborated and the treatment regime was tweaked, and I started to receive some treatment. And the doctor said, "Well, you learn something new every day," which was great for her, not great for me, because I wasn't being listened to. My stay in hospital was extended because I'd become so poorly, and of course my recovery was compromised. It took me a long time to get over something that should have been quite quick. If I'd had data share, if I'd had some record to take with me to the hospital, even though my notes were there, because my condition is rare, they don't understand what the implications are. So I have to have that information to share with people. And although I'm very knowledgeable, nobody's prepared to take it from me that what I'm saying is correct. So that's acute life, but long-term condition life also has its own issues. We are managing most of the time in the community and keeping chugging along. But suddenly, if we have relapse or remission, we need immediate help and input to keep us in the community. And at the moment, we can't access those services in any timely way. If we had data share which showed what had to be done when we had relapses, etc., we would be able to access services, we would be able to retain a quality of life, and we would be able to stay in the community with less cost. So we're already doing this as patients, as parents. There are data share devices out there that we use. The top two are USB tags. You take your USB with you to the hospital, but of course they won't plug them in because they're scared that there is a computer virus risk. So we have all the information and no one will look at it, and I'd really like somebody to be able to sort that out. And then in the bottom we have the QR code bracelet, which is now quite popular, especially with the young people. You scan that with a smartphone and you go to a web page that has all the patient entered information. And although we generally use these in kind of emergency situations, it's there to be shared with whoever you want it to be shared with. Now, I particularly like these because my son's 17, he's trying to get out and about a bit more, and I've got the peace of mind of knowing that he's got something on him where people can access his complex information. He used to carry letters around in his pocket, but I'd put his jeans in the wash and they'd come out in all bits and rats and whatnot, so I was forever having to reprint them. So what could it look like for us with a future of data share? Well, hopefully like this, with a team of skilled operators, all knowing how to use the machinery, making those right connections to get the right information to the right place, and ultimately, again, I keep saying it, but improving our quality of life by having access to this information. And where will that lead us? Well, hopefully to something like this, where we're all getting on with our lives, we're all enjoying our quality of life and taking our data share with us into the future. Thank you very much.